much anyone who has driven between Powell and Cody certainly recognizes the hospital chimney. It's visible for miles and was, and actually still is, one of the tallest man-made structures in the area. So it's a pretty well-known landmark. It and the other buildings that you see here are the only buildings from the camp that are still in their original locations. Originally, the hospital at Heart Mountain had 17 buildings. It was one of the largest hospitals in the region, which kind of makes sense because with over 10,000 residents, it was the third largest city in Wyoming at the time. For a sense of scale, this portion that's fenced off is only half of the original hospital complex. During the days of the camp, there were dormitories for the hospital staff, the doctors and the nurses, an outpatient clinic, a dental area, pharmacy, OBGYN and delivery wing, an emergency room, and the wards for the patients. One of the biggest problems that Heart Mountain had, along with all the other camps, was finding and ultimately keeping doctors. It was very difficult to convince a white doctor to move to a place like this unless they were already from the area. As for the Japanese American doctors, usually working 8 to 10 people under one white doctor, considering that while they worked in the camp, they made about $228 a year, whereas a registered nurse made $1,800 a year. So it was easy to see why the doctors were quick to move out of the camp or even switch to a different job within the camp, if they could. When the camp opened, there were over 150 employees at the hospital, including 9 to 10 doctors, 10 registered nurses, which were all white, and 20 Japanese American nursing assistants, some pharmacists, some dentists, and even a few optometrists. With over 30,000 hospitalizations, communicable diseases were one of the major concerns all over the camp, but especially in the close quarters of the hospital and with everyone eating in one mess hall. With limited and inconsistent supplies, as well as a lack of specialists, treatment of patients varied. In fact, one patient was diagnosed with glaucoma, but because of the lack of supplies and no ophthalmologist to care for him, he went blind. The mess hall for the hospital staff and the patients is the largest of the remaining buildings. Here's an interesting tidbit about what was prepared in the kitchen. Most new mothers of that era used baby formula instead of breastfeeding. But there was no way to prepare the formula in the barracks. So the hospital prepared the formula and then ambulances drove it around the camp to the new mothers. The building here was a warehouse for supplies. There was a second warehouse. All that's left today is the concrete foundation. The other building foundations remaining are the laundry and the morgue. Yes, there were some deaths in the camp, although there were many more babies born. There was a long, unheated hallway between the two sets of buildings that connected the two rows. On the other side of the hallway would have been the surgical area and the wards for the men, women, and children. The chimney is perhaps obviously the most visible, but more importantly, the boiler house was the part of the hospital that was so important. It had a lot of work to do. The hospital wards were heated by steam, the only centrally heated buildings in the complex. In fact, there are stories of incarcerees feigning illness to get a bed in the hospital during the harsh Wyoming winters. There are a lot of stories that can be told about the hospital and its occupants. There were all sorts of rivalries between the doctors, and several strikes happened over working conditions and questions of status and respect. And of course, there are stories about all the lives here, some that ended, and the many that were born here.